Good afternoon, everyone, and welcome to the U.S. Chamber Foundation's Path Forward series. Whether you've been joining us regularly or you're new to the series, you are most welcome, and we thank you for spending your time with us. We hope that today's discussion will provide actionable learning that you can help implement in your communities and your organizations as we all try to navigate the return to health and the return to work. This afternoon, we're going to talk about some of the most important things that we've learned so far in the pandemic and how we can act on those insights to mitigate another wave of the virus. You know, at the beginning of the crisis, as we've talked about a lot here, no one had any idea what we were dealing with. And so the sweeping, really devastating shutdowns were necessary to combat a really unknown threat. But now we're informed by time, by science, by experience, and we have a better understanding of how to protect ourselves from the virus. People and businesses both have adapted, and if we follow the public health guidelines, we can prevent another shutdown so businesses can stay open and keep our economy headed in the right direction. Crucially, we now know masks work, testing is crucial, social distancing and gathering mainly outdoors make a real difference. But even with that critical information, we're approaching a new unknown. How will the changing of seasons impact the spread of COVID-19? What can we do to combat the twin threats of COVID-19 and the seasonal flu? We have a panel of experts with us today to help answer those questions. We are very pleased to welcome Dr. Nahid Badalea. She is an infectious disease physician and associate professor at the Boston University School of Medicine and the medical director of Special Pathogens Unit at the Boston Medical Center. Also joining us is Heather Schultz, pharmacist at Meyer Pharmacy, to talk about flu shots and why you should get one today if you haven't already. We're also pleased to be joined by Jihan Umar Siri. I'm learning how to do this, I have to admit. Jihan Umar Siri Wardena, president and co-founder of Ministry of Supply, a science-based clothing company that's transitioned to making masks. And finally, we have with us Dr. Satoshi Matsuoka, director of the Riken Center for Computational Science, which is using a supercomputer to study how COVID-19 spreads, and that really informs our safety measures. As usual, we'll have audience questions at the end, so please submit them as we go along. And let me start here with Dr. Badalea. Thank you so much for being with us.
Thank you for having me, Suzanne.
So tell me, where do you think the pandemic stands today?
Well, Suzanne, I think we're currently in the 10th month of this pandemic in this country, and people may be surprised by that because what we've now discovered looking back is that there's evidence that we actually had COVID-19. There was community transmission of this infection within our borders as early as potentially beginning of January. And what we've seen is this general trend where we've seen multiple periods during which cases, hospitalizations, and deaths have surged in different areas of this country, beginning with the Northeast and the West, seeing a very hyper-intense transmission in the spring, followed by the South and the Southwest in the summer, and now we're seeing a hyper-intense transmission really on the North, in the Midwest. But in general, the troublesome trend now is that we're seeing potentially, people try to discern what wave we're in, what surge we're in. I think as always, as someone who does this work with infectious diseases, it's in outbreaks in particular, it's very hard to discern these things unless you're looking at them in retrospect. The one thing that we can say is that we're in a very specific third surge where we're seeing this increase in cases. So aside from the Midwest, we're actually seeing the numbers increase widely across the nation in many, many different states, over 35 states at this point. There are some good points to this. We've seen the mortality for people who are hospitalized actually go down over time. And so that part of that improvement, there was a study recently from NYU that talked about that when someone is admitted, at that point in the worst months of the spring in New York City, the mortality was about 25%, or a quarter of the people could pass away. That same institution has now shown that their mortality has gone down to about 7.6% or about 8%. And that's with our greater understanding of the way these patients should be treated. Unfortunately, it's probably also the fact that we're admitting younger patients. We've seen this trend that it's not just older patients who are getting admitted, but as the disease has moved through the country, we've seen younger patients get sick enough to get hospitalized, and they're thankfully not as many of those are passing away. And so there is some silver linings, but as you said, some challenges ahead.
And a lot of people are wondering what the change of season means and what the coming of winter means. And so what would you tell our audience about that?
Yeah, the concern has always been that, fall and winter are sort of the traditional months in which respiratory viruses find it very easy to transmit because of the cold and dry weather. And so influenza, your cold and flu seasons, just your run-of-the-mill coronaviruses, which are your, cold viruses. And so similar to that, what we've been dreading is that SARS-CoV-2, the virus that causes COVID-19, might follow that trend. And there is some concern for that because, I was just looking at the numbers right before we talked today, and we're seeing, there's a 30% increase in cases. And like I said, majority of the big changes have been in the Midwest, but this is across the board in many states across the country. We're seeing hospitalizations that went from our very low in August at about 28,000 nationally to over 40,000 now. And this is the most striking thing to me. Deaths, which we know are the lagging indicator. Once first we have the cases, then the hospitalization, then the deaths follow. Deaths are actually increasing in 22 states. And so the largest increases are in the Midwest, but even states like my own Massachusetts and New York are seeing increases. And so seasonality probably has a role to play. And the other thing that we worry about is that people are moving indoors, and the fact that there are co-circulating viruses such as influenza, where if people get sick from influenza, they may require the same beds and the same hospital sort of care that those with COVID might.
And so a question we get a lot, there's a lot of hope pinned on a vaccine. And so how close do you think we are?
I actually am one of the optimistic folks probably in this. I think one of the things that there are many issues in which that we stumbled on with this pandemic response, but one of the bright spot was probably Operation Warp Speed, which what it did was it invested a ton of money and government money, public investment in these very promising technologies of different types of vaccines as well as therapeutics. And they had sunken costs put in terms of buying a certain number of doses, regardless of whether or not it was successful, as well as setting up manufacturing capacity. What we now have is a setup in which we have 4 leading vaccine candidates in advanced trials with results in at least those that crop of vaccine trials coming out at the end of November, beginning of December. So Moderna and Pfizer, 2 of the leading candidates, have actually said that they might submit for an emergency use authorization as early as potentially end of November. I do want to caution one point about this, though, that even if there is an emergency use authorization, from what we know from the CDC and the Health and Human Services, is that majority of Americans will not get access to that vaccine until the spring or summer of 2021. The first crop of doses, around 30 to 50 million, will be for healthcare workers and those who are the most vulnerable in our society.
So we think about what we've learned, and we've talked about how that's positively impacted the mortality rate. We've talked about where we're still learning and growing in terms of getting to a vaccine. And I think another place that people are still a little bit confused is about testing. And so there are a series of questions like, do we have enough testing? Who should get testing? What are the barriers to testing? And so help us understand the current testing climate.
Yeah, Suzanne, I think it's good to sort of stress that, there are still challenges, and I think there are going to continue to be challenges in testing. But in the place that we were at in spring was that we were delayed in trying to get tests that were accurate and enough tests out to the people who were hospitalized, even people who were sick. And generally what you saw in that scenario is that people who were getting tested were the sickest and those who were hospitalized. Now, do we have enough tests to cover everybody who's hospitalized? Yes, we do, but we don't, there's still whether to ask that question of do we have enough tests or not, you have to step back and say enough tests for what, right? If you're only looking to diagnose people who are symptomatic or people who are hospitalized, in most states, I think that we're getting closer to be able to do that. There's still, unfortunately, the trouble is, as with anything that's a supply-demand, scenario, as most business owners would know, this depends on the demand. If the demand goes up and the community transmission and the rates of infection go up, there will be more demand on that. We are still, and so the other challenges in the spring that we had majority of the testing that we did were on these genetic tests, the PCR-based tests that are tests that look for the viral, the pieces of the genetic materials of the virus itself and people who are acutely ill. And the material that we needed, the personal protective equipment, the swabs, we're really highly constrained. We couldn't get majority of the hospitals that were affected couldn't get their hands on enough of these. That's better, but we're unfortunately still facing that. I mean, I myself am trying to put an order in for nasopharyngeal swabs. This is one of the tools that we use to do these tests, and we're finding that the market is still strained. We have improved in some ways. We've improved, technologies such as introducing rapid antigen tests, which can be useful in people who are symptomatic, in particular early in their disease or right after they've become symptomatic. But we have a bit of time to go in terms of access for the consumer. Every state is different. I think and it depends on what you want to get tested for. If you're symptomatic, your insurance and your clinic should be able to cover that. If you're trying to get tested because you want to travel, it's actually not covered by a lot of insurance companies. The other types of kind of testing that we would want to do because we want to keep businesses open is actually testing of close contacts for public health. So people who've been exposed, they should, could potentially have access to testing, and we're not there yet to get everybody who might have that in some of the states. We may want to do colleges and schools, ensuring that people who, when we're opening up our colleges and schools, we're keeping them safe. And then that's highly variable. There was a study in mid-August that said only 1/3 of colleges are actually doing, even 25% of the colleges are doing routine surveillance testing in their students. You may want to use testing in your employees in very high-risk industries like agriculture. There was a study with CDC that said huge impact on food workers and agriculture workers. And so we don't have enough testing to meet all needs of society, but we are better now than we were in the spring.
So one question before we turn and bring our next panelist in. There's a lot of conversation in addition to seasonality about the flu and the importance of getting flu shots. And I guess wrapping this all into one question, both how do you think that individuals can protect themselves from these twin threats of the flu and COVID-19? And what role can businesses play in promoting good health?
Well, this is an important point. I think the reason we worry about the flu and the SARS-CoV-2 together is that, as I said, partly because if people get sick with one or the other, they're competing for the same healthcare resources. But the other is now there's evidence that if you get sick with both together, there's a study from the UK that showed that those who had both COVID-19 and flu had about, a little bit over twice the chances of dying in the hospital compared to those who had COVID alone. And so this is the year, to get your flu shot. So the way that we as individuals protect ourselves are, of course, wearing a mask, physical distancing, trying to move as many activities outdoors as possible, avoiding indoor crowds, hand hygiene, and getting those flu shots. And as businesses, I think big thing that we've found about this is the importance of ventilation. Most businesses are not outdoors. And so how do we move forward? And aside from all those measures we just talked about, it's becoming ever more evident that ventilation is another part aside from disinfection and promoting potentially access to those flu vaccines among your workers, because same as us doctors, when someone comes in with, symptoms, respiratory symptoms, we don't know if it's COVID or flu. And I think businesses may face the same scenario. That's why ensuring that your employees have access to that flu or know where to access that flu shot is going to be important, because that will reduce illnesses among workers that could be confused as COVID, even if it's not.
That's so important. I think we just have to underline that point. And we're going to come back with more audience questions for you in a minute. But next, I'm going to bring in Heather Schultz, who is a pharmacist at Meyer Pharmacy. Heather, thank you for being with us, and talk to us about what you think our viewers really need to understand about this coming flu season.
Yeah, definitely. First, I want to say thank you for hosting this program and really helping to get out all of these important messages. As a pharmacist, I want to say clearly that flu vaccinations are important every year, but this year even more specifically because of the COVID-19 pandemic. Unfortunately, influenza, it's unpredictable. While we have flu every year, the timing, severity, and length of the season varies from one season to another. And this year, like we said before, it's more important than ever to protect yourself and to protect your family from influenza. As we know, influenza symptoms are now analogous to COVID symptoms, and with current quarantine protocols, an influenza infection this year could lead to more time away from work, school, social life, while we're determining those root cause and trying to get testing.
I think it's such an interesting point. I think one thing we're worried about in the business community is that people are getting conflicting messages, and there's kind of disinformation about there that says, look, we're all wearing masks, nobody's going to get the flu. I don't have to get my flu shot because these other measures are going to save me. And we had kind of a mild season in the Southern Hemisphere. And so what do you say to all of that?
Yeah, I mean, definitely to all of that. First and foremost, the flu shot is necessary, whether we've got a pandemic or not, whether we're wearing masks, increasing hand washing. It is one of the most important things that we can do to protect ourselves and protect our communities. However, with the combined risks of flu and COVID to individuals, our communities, and our nation, it's significant, particularly this year. Public health experts emphasize that getting the flu shot is the most important step that people can take to prevent those flu infections in themselves and their loved ones. In pharmacies now, we're definitely seeing an increase in demand for flu vaccinations this year, which is a positive sign. People are listening. But we still need to ensure that all Americans hear this message, that it's important to get the flu vaccination among all of the other steps that they're already taking to stay healthy and to stay safe. So I want to encourage, your loved ones to get vaccination. And it's especially important for people who are at higher risk of flu complications, such as those with comorbidities, as well as our elderly patients and their close contacts.
So one of the other reasons people have for not getting a flu shot is they say, oh, we don't always get the shot right. The flu changes every year and the vaccine isn't always effective. And so let's hear your best rationale for, does the flu shot work?
Yeah, definitely. Overall, the flu shot is safe and effective to help protect ourselves and our communities against the flu vaccination. Well, some people say that, well, it doesn't work. I got the flu from the flu shot or things like that. I'm here to say, unfortunately, you can't get the flu from the flu shot. Overall, it's very safe, effective, and it's important to get every year.
Is there a best time to get a flu shot?
Well, I'm happy to ask because there's no better time than the present. So actually right now is a great time to head into your local pharmacy to receive your annual flu shot. Every year, usually once September rolls around, September, October, it's the best time to start getting vaccinated against the flu. And doing it now, we want to make sure that we're fully protected before we get flu being active in our communities. And once we receive the vaccination, it takes a couple weeks for our bodies to produce those antibodies to really fully protect us against the vaccine. So, right now, head to your local pharmacies if you haven't received a flu vaccination and go ahead and get yours today.
That's so interesting. I think in all the years I've been getting flu shots, I never knew it took a couple weeks to start get them to fully effective. That's a really important reason to go get it today. Is it expensive?
No, that's the best thing about a flu shot. It's something that we say, hey, you have to get every year, and it's covered by most insurance plans at a $0 charge. So, how can you not get a flu shot when it's free of charge and it's very easy to head to your pharmacy to receive one?
Are there choices I'm trying to understand, is there a nasal spray and a shot, and what is this 4-strain flu vaccine? How does all this work? Are we supposed to make these choices as consumers? Tell us about this.
Yeah, definitely. So every year they release a handful of different flu vaccinations to the market for us to immunize the public. There are 2 different delivery systems. So to highlight, we do have a nasal spray called Flu Mist, which is a live attenuated vaccination, which contains a weakened form of the actual flu virus. The Flu Mist is available for those patients aged 2 to 49. However, it does have some limitations on the patients that are eligible to receive it. Any of our patients who are pregnant or immunocompromised, unfortunately, would not be candidates for this vaccination. On the other hand, the most common type of vaccination for the flu is just the general flu shot. that the flu shot is inactivated or a killed vaccination delivered through an injection, usually in the upper arm. The flu shot is approved for 6 months and older, and also there's a formulation for those who are 65 and older as well. You touched base on there's 3 strains, 4 strains. In the past, there were 3 strains of the flu shot. However, the flu manufacturers have slowly adjusted their processes to allow for 4 strains to allow broader protection for our patients when they're receiving the flu shots. So 99% of all of flu vaccinations released this year actually contain 4 different strains to allow for that broadest protection. Now, when we do have a lot of people asking, well, what flu shot should I get? I have no idea. It's very overwhelming. Head to your local pharmacy. Come talk to your pharmacist. We have all that knowledge to share with you and to educate you on. And it can often be very overwhelming for those patients. But to start overall, any protection against the flu is the most important thing that you can do. And the CDC also recommends that to healthcare professionals never to delay a vaccination in the absence of a certain formulation. So overall, since the FDA has released 99% of the vaccinations to be a 4 strain, I recommend for anyone to receive the 4 strain vaccination. But those who are 65 and older, if Fluad or Fluzone high dose is available, those are the 2 vaccinations for those specifically 65 and older. I would recommend for them to get those just because the 2 vaccinations add a little bit added protection to our elderly patients. But again, even if it's not available, you just want to make sure you receive a flu shot during the season.
So Heather, what would you say to people who are trying to avoid coming into a pharmacy because they're worried about just being in a crowded indoor place and they're worried about a line for a flu shot? Or how are you working to keep people safe when they come in to get a flu shot?
Yeah, so I mean, this is something that pharmacies have been planning on for a while. COVID started hitting in March, and we all knew that flu season was coming up, and we're going to have to continue to immunize the public, but we're going to have to make it safe and make them comfortable to come into our pharmacies. So a lot of pharmacies are implementing the guidelines from the CDC, practicing social distancing, ensuring the use of masks, completing temperature screenings before patients can get flu vaccinations as well. I know some pharmacies allow patients to make appointments ahead of time for their flu shot. And then other pharmacies like us here at Meyer, we've got a contactless option where we actually can send our patients their screening questionnaires ahead of time. That way they can fill out at home and come into the pharmacy when it's a convenient time for them. That way it decreases their overall wait time at the pharmacy, but it also encourages social distancing and enhances our patient experience.
So, as you know, this pandemic has really highlighted the disparity of access to good health care for minorities. And one of the major challenges is, of course, location. Now, on the other hand, 95% of Americans live within 5 miles of a pharmacy. So you would think that there's greater access to flu shots. So how do you think about the impact of flu shots in particular on the minority community?
Yeah, I mean, this is an area that disparities in care, it's been an issue that we've been focusing on for quite a while. But like you said, pharmacies and pharmacists are definitely a resource that can help our communities for the fact that we're within 5 miles of 90% of Americans. In addition, many of our pharmacists have a great outreach in their communities. Patients come into the pharmacies because of that relationship they have with their pharmacist. And it's been shown the importance of pharmacists in helping confront any of those healthcare disparities that we have, even if it's in chronic conditions such as diabetes, and definitely in vaccine preventable illnesses. In regards to raising awareness of the importance of the flu shot in preparing for COVID-19 vaccinations, once they're safe, available, and effective, pharmacists, we really do have an important role of reaching out to those who have suffered from healthcare disparities. Our association, the National Association of Chain Drugstores, has launched a campaign to help communicate flu-related messages to these diverse populations. Our campaign amplifies the work of pharmacies across the country and in the communities that they serve.
Well, we are good friends with Steve Anderson, the chair of NACDS, and we know if he's running the campaign, it'll be a strong one. Let me ask you to before we bring in the next panelist, let me ask you to just speak to all of the business leaders in the audience. What can business leaders do to help spread the word about vaccinations, about flu shots, about this season? What's your message to the business community?
Yeah, definitely. I think it's very important for our business leaders to raise that awareness that we need to help prevent this two-front war with COVID and the flu, and informing their employees how important the flu shot is and how important it is to get it this year. We want to keep our employees safe and healthy, but at the same time, we want to help grow our economy and keep going along the job creation and getting it back on track with healthy employees. So really, foremost, we just need to get the message out to our employees and our communities. Overall, I would encourage business leaders to reach out to their local pharmacies to learn more about opportunities to help collaborate and making it easier for their employees to receive a flu vaccination, whether that's doing on-site clinics or doing off-site clinics, providing vouchers for their employees to receive flu shots if they're not covered underneath their insurance. I think it's a critical time that business leaders need to reach out to their employees, to their pharmacists, to find the best way that we can prevent this two-front war with flu and COVID. And we definitely have a large role to play in spreading the word and stopping the flu this year.
That was really helpful. Thank you for that. And we'll bring you back in for some audience questions. Now I want to bring in Jihan Umara Siriwadena, who is with us. He is the president and co-founder of Ministry of Supply. Thank you for being here. So your company creates science-based clothing. What is that? What is science-based clothing?
Yeah, so Ministry of Supply, we make, traditionally we've made office clothes, but garments that are all made of performance materials. So they're moisture wicking, wrinkle free, machine washable. They're really designed to be incredibly comfortable. And it's all unlocked by materials technology and new manufacturing techniques. So we've been using a lot of advanced materials, whether that's phase change materials for dress shirts to keep your body temperature comfortable, to advanced computerized knitting techniques to produce garments that conform to the body. And so we've been using these techniques of machinery, new machinery and manufacturing techniques, as well as novel innovative materials to really solve the challenges of comfort and clothing. And that has actually applied towards more comfortable masks and an ability to produce masks efficiently, particularly during the early months of COVID.
Later, when we're back in the green room, I'm going to ask you if you have science-based clothing that could help me take off my personal COVID-19 while I'm wearing them. I think that would be really helpful. But let me start with this. So Fast Company has said that your face masks are the best they've ever seen. So what does that mean? What's the science behind your mask?
Yeah, so when we produce our mask, we use a technique that's called, it's computerized knitting, and it's a 3D process. So when we look at the effectiveness of a mask, there's two things that we look for. One is the fit. So we're looking at, does it conform to the face of the mouth and cover the nose, mouth, and create a good seal around the face. And the other part is effective filtration. Now the challenge, particularly early on, and what was straining the supply chain around masks was really the fact that the mask filter material it's effective at filtration, but at the same time, that's the part that gets exposed and needs to be changed more frequently. And so we try to decouple those and make a reusable mask. And so in this case, we actually used materials that were existing in our supply chain and repurposed them for making a frame for the mask to hold a disposable filter. We developed this mask with the self-assembly lab at MIT. This is a lab that we've worked with for many years around climate active materials using computerized knitting and advanced materials to make materials that actually react to moisture and heat to make them more comfortable. And we've used a lot of those principles in the development of this mask. We also worked with the Little Devices Labs at MIT that develops medical devices at differing scales, but using rapid manufacturing techniques. And so one of the reasons why our mask was so effective is the fact that we were able to develop it quickly, create a fit that's incredibly comfortable, both for consumer use and also for frontline workers when there was a shortage of PPE. And then we also have a mask filter that's made out of a polypropylene melt-blown material. It's the same type of filtration material used in typical like N95 masks, for example, but we were able to use it in a different form factor that allows it to be disposable and to reuse the mask frame.
Where are you selling them? Is this to individuals, to businesses, to healthcare systems? Is it more wholesale or retail?
Yeah, so initially, actually, what kind of spurred our development and production was donations to healthcare workers, particularly here in Boston. There's a lot of hospitals here that we worked with directly for the testing and evaluation of these for frontline use. And then as the recommendations were given for the public to wear them, we opened this up for direct consumer sales. So we sell directly through our site. And one of the things that was really innovative and kind of quick response from a quick response perspective was not just our quick development, but also rapid production. So by using computerized knitting, we're able to go straight from development in our production samples to production over 40 machines across the US, both in New York and in LA. So for the past 6 months, we've been running this production nonstop and actually shipping the masks directly to consumers.
So you had sold out, right? You were sold out everywhere over the summer. So what does supply and demand look like now? How are you thinking about production moving into the winter? I mean, I love this business story. It's a fantastic success story of business innovating to meet such an important health demand. But tell us about the business side, the supply and demand and production.
Yeah, absolutely. So supply and demand there's been no better time to learn about that than right now. You know, in terms of raw materials, that was something that was quite challenging to acquire. And so I think one of the suggestions for companies is, as they look at these challenges, is look at the materials that you have in your supply chain and look at ways that you can use them in novel ways. So actually a material that was reserved for making sweaters and blazers, for example, but was in raw yarn, we were able to repurpose that to make our masks and actually knit masks directly from that. The other point is to look at other industries that have similar materials that may not be utilized right now for the application that we're looking for, but can pass the certification tests that are required to meet, for example, the ASTM test, which define whether a mask filter is effective or not. So being innovative about the materials, understanding the materials at their fundamental level, and then using the known standards out there to determine whether it's effective. So our materials are tested by Nelson Labs, and so the same labs that test the NIOSH N95 masks as well. And so that was a way that we were able to kind of look at what's available in the US supply chain in particular and utilize a rapid production. So whereas typically production of this kind of product would be made in high volume, but over a longer period of time, we were able to produce these every 9 minutes. A mask comes off of one of our 40 machines. And so it's allowed us to run this machinery nonstop. And our primary constraint has been raw materials.
So the Surgeon General was on this show recently, and he was talking about that he's predicting that mask wearing will outlast the pandemic, that we're learning that it aids public health across the board. And so what do you think? Are masks here to stay? Will you stay in this business?
Yeah, I think we believe that science can make clothing a lot more comfortable, and one of the most intimate things that people are wearing these days are their masks. And so we've looked at both the science and the functionality of that, but also the comfort, because we think comfort is going to lead to better compliance. We'll stay in this business because as long as we're innovating and we're moving forward the industry. And so, for example, we're now in our 3rd generation of our knit masks, and a lot of that has come from feedback of customers wearing it and giving us insight into how they're using it in the real world. and how we can make it more comfortable. And so we do believe it's going to stay around. We look at other markets and how they have responded to other pandemics and or infectious diseases. And so there has been kind of proof and track records of society, continuing to use masks afterwards.
So you're not only producing an important piece of PPE for the world here, but you're also an employer. So talk to me as an employer, what are you telling your employees right now about the virus and how to stay safe?
Yeah, so for our team, we at the beginning of the pandemic, we did have 6 stores, and I think the reality is that physical retail is really challenging, both in terms of maintaining social distancing in small stores, for example. So we did close our stores for 3 months, and once the right protocols were in place and that we felt like each market was adhering to the right mask wearing protocols, we did reopen our stores. That being said, candidly, that we haven't seen the economic recovery and foot traffic that we'd expect in those locations. So we have temporarily closed a few of those, but we do have our Boston store still open. We're a company that believes in science, and so we constantly publish the latest data from the CDC and the NIH, to our teams, and that's what we use as our guiding force. We rely on the input of the medical community to drive that, and so right now the majority of our team is remote, and when they do need to be in person, we have socially distanced work environments and stores, as well as mask wearing.
One of the things that we've talked about, we had an executive of Starbucks on the show, for example, the president of retail for Starbucks. And one of the things we talked about is how hard it can be for frontline people to ask their customers to put on a mask, right? And so as you're looking out at this audience of business leaders, how do you advise people and talk to your employees or your customers and ask them to put a mask on?
That's a really good question. We, as a business, kind of one of our kind of primary goals is to educate people about the science of the products that we create and the materials and manufacturing processes around them. And ever since we went to quarantine, we have a company blog, for example, and we've been publishing continuously what the latest data is around mask usage, why they're effective, and how different materials can affect the efficacy. And so we've, as a business, we've built some authority there around science and apparel, and we've actually kind of used that opportunity to speak to our customers, to educate them, so that they can use that as kind of information that they can spread to their own communities. So we think it's a duty of our business not just to sell products to allow people to be more safe, but also to educate them about why.
Oh, it's a great story. I really appreciate you sharing it with us, and I'm sure the audience will have questions for you. I'm going to bring in our final panelist now, who's up in the middle of the night in Japan to talk to us. So welcome to Dr. Satoshi Matsuoka. We are happy that you are here with us. And again, I'm sorry for the early or late hour, depending on how you look at 4 o'clock in the morning. What's the current status of COVID-19 in Japan now?
Well, firstly, thank you very much for having me on the show. By the way, take my flu shot and wear masks. So, the situation in Japan is somewhat controlled. The number of infections have been in the hundreds, sort of stagnated, haven't gone down or gone up for several months now. So there's been a lot of cautious reopening of the societal activities. So, if you look at everybody wears masks for protection, but, there are a lot of people on the streets and, shops, restaurants are open. But if you look at the details, for example, sporting events are open now, but, they're running at reduced capacity. Some are, obviously, if you look at the hard figures, the businesses are still compromised by the, reduction in sales and so forth. So I think, and the government's really taking various measures to try to balance between the reopening of the economy versus mitigating the risk of infection by various means, and scientific means, by the way. So we're very appreciative of the government's support to institutions like us to come up with these measures.
And speaking of that, right, your team has been using a supercomputer to look at how COVID-19 particles spread. Tell us about your research and what you've learned.
Well, firstly, supercomputer, we have the fastest supercomputer in the world that we had built and been designing and built for the past 10 years. So, but it was an immediate call to action, how we could use such a significant power. It's equivalent to like 20 million smartphones. So we're doing everything from looking at pharmaceuticals, drug repurposing, to like things like impact of lockdown on the economy, doing a whole bunch of analysis and simulations on machines. But like you asked, in particular, we also have been looking at the droplets, aerosols, and how they spread, for example, because surprisingly, there have been some studies, but large-scale studies of these haven't been done as much as you might think. And also coupled with these protection measures like masks and face shields, and placed under social settings like dining tables and classrooms and public transportation, these haven't been done before. So we're running tons of simulations basically to try to answer some of these questions. For example, what are your risks when you ride a train or you get on the airplane? Should be wearing masks, or what are the effects of face shields compared to masks? And are there any other product innovations like the previous speakers were doing? Would there be any sort of innovations possible to mitigate these types of aerosol droplet infections?
And so what did you learn about how masks protect the wearer against infection?
Well, yeah, so maybe we can show some simulations that we have done.
Sure.
We can put them up on the screen. Yeah. So this is a simulation of the masks, different types of materials, and the upper animation shows how much of these micro droplets, the aerosols that are escaped from the mask when you cough. The bottom shows how much are captured. The red ones are the ones that are captured by the mask. So this tells you two things. But firstly, masks are effective. A lot of the larger droplets, those are like 100 microns and so forth, that contain a lot of viruses, do get captured by the mask. And also the materials matter. Non-woven masks do a much better job of capturing these droplets compared to things like cotton fabric, which are more sparse. But also tells you that masks are not panacea. I mean, they need to be combined with other mitigation measures, because you see that the yellow particles, these are micro droplets that escape because when you cough, it exerts a pressure onto the mask, and and masks cannot be 100% sealed unless they're like medical masks. So they escape, and they do contain viruses, so they need to be circumvented by other measures, especially ventilation. So it tells us many things about the strength of the power of the mask, but also tells us of our limitations.
So the takeaway is really masks are important. The type of mask is important, but again, the layer of protection is important as well, not relying just on masks.
Exactly. So if you can see the next animation.
Mm-hmm.
Yeah, so this is comparing masks to face shields. So there are a lot of questions people have asked us. Are face shields more effective? And again, our simulations show that on A, they're effective against large droplets. And as you can see, a lot of the droplets are captured. However, in terms of the aerosols, they are much less effective compared to masks. So when majority of people are wearing face shields, you want to have even strengthened measures for ventilation and masks as well. But the risk mitigation is stronger with masks as compared to face shields.
What do you think about combining them?
Yes, combining them is of course effective. if you combine face shields and masks, it's double protection. So the lesson here is that they do combine the effect of masks blocking the droplets and aerosols, and then the face shields providing further protection, let's say to the eye, is effective. But we can go to the next animation. Yes, so this is sort of what's happening to you. So this is really scary. This is the left-hand side. This is what happens when the unprotected person coughs. So this is within about a meter. So it's about slightly within the sphere of social distancing. And you can see that the other person is bombarded with aerosols and droplets. But the face shield is protecting him to some degree. If you look at the right-hand side, if you run the animation, if the person who's infected wears a face shield, or mask for that matter, majority of the droplets are blocked. And for the face shield, they actually land on your clothing. And the combination of these protective measures could be quite significant in terms of protecting, mutual protection and also suppression measures. So, and it's really important. What our simulations, of course, are the quantitative measures are intended for the experts to utilize. However, these simulations, when we have press conferences, are immediately shown on national TV. And this has really helped to communicate to the public the importance of these types of protective measures. So, a lot of people come to me and say, I've seen your simulation on TV. And, I had some doubts about how masks or face shields may be effective, but now I'm really convinced that they are. So these types of simulations also help to educate the public, and that's been one of the biggest benefits of having these simulations visualize the viruses and droplets, which are otherwise invisible. So people really don't know what's happening.
I couldn't agree with you more, and I think particularly this simulation really shows that you don't wear a face mask or a shield because you're afraid. You do it to protect somebody else. It's a selfless act too. You also did some work on the impact of temperature and humidity on the spread of particles, right? Can you walk us through that?
Yes. So we have very detailed simulation capabilities of not just simulating the air and the droplets. We also simulate the effects of the droplets. They dry up as they travel through the air, obviously, and the differences in humidity actually cause the drying up to be quicker or slower. Obviously, if you have high humidity, then the droplets tend not to dry up, and they don't turn to aerosols. Whereas low humidity, they quickly dry up and become aerosols, and they stay in the air for a long time. So this is 30% humidity. And you can see that the amount of droplets was in yellow drop on the desks, but they're very few in number, and majority of them turn into aerosols, and they just float in the air for a very long time. So in low humidity environments, obviously ventilation becomes really necessary in order to try to circumvent these effects. Whereas if you go to higher humidity, if you can do the 60%. Yes, so you see that the amount of aerosol, the blue particles, are much less, but you see more droplets dropping on the desk. And if you go to the 90% humidity, hot summer month in Tokyo or East Coast of the U.S., you see that the majority of droplets don't dry up, but they land on the desk. So then you resort to other sanitary measures like wiping your desk with alcohol and more, or any other sort of sanitary equipment. And so obviously the how you protect yourselves and how you protect the others may depend a lot on the humidity and the environment and other factors. This is just changing the humidity, but there are many other environmental factors that come into play. And the protective measure, the most effective protective measures actually could differ according to your environmental situations.
So as you look at this, and you're talking to an audience of business leaders today, what would you recommend businesses do to create a safer environment for their customers and their employees?
Yeah, so obviously you would need to follow the various government and industrial guidelines. And so obviously, in Japan, also of course in the U.S., these guidelines have been done with all the empirical evidences that's been accumulated over the years with respect to these types of studies, done more empirically. And at least in Japan and possibly in the U.S., these are being fortified now with the various additional scientific studies, including these supercomputer simulations. So these guidelines are, by and large, correct. But in some cases, you have to be very cautious sometimes, because sometimes these guidelines are being corrected. Because for example, in our case, the government guidelines said that at a dinner table, people should be sitting side by side, but then said respecting social distance, which is like a meter away. But usually you don't sit side by side, meter away. So what they have done when they spread the word is they kind of drop this meter away portion, and they should be sitting side by side. Well, unfortunately, our simulations have shown that if you sit side by side without protective gear, then the person sitting next to you gets bombarded 5 times more aerosols and droplets compared to someone sitting across. So when we revealed that, people were shocked, and they're revisiting these guidelines. And oh, by the way, and also the second thing I think this industry can do, and a lot of industry now work with us, from airline companies, transportation companies, air conditioning companies, but also like food and also restaurant industry works with us. So this is a simulation of different types of mouth guard that will be potentially effective in like restaurants and bar settings. And this kind of shows what the shape. If you look very carefully, the person that's emitting these aerosols have a different shape in terms of their mouth and nose coverings. So this is a work with Suntory and Toppan. Suntory, the whiskey company, but they have lots of restaurants. So we're helping them to design something like this, a protective gear that can be worn in restaurants, not a very nice model. It's just me, but
is the mouth open there? I can't tell.
Well, so it opens up like that.
I see.
It's very easy. I've tried it myself. It's very easy, much better than kind of lowering the mask.
Yeah.
And this was also true for the previous speaker, in which he said they're designing masks which are much more comfortable to wear. So I think what the industry can do is not only to come up with to comply with the various protocols and guidelines, but also really think about what could your product or services, how can they contribute to these types of mitigations? What can your products and services do? Mm-hmm. And because we work with a lot of experts, and they tell us that this COVID-19 situation is not accidental. The SARS happened 10 years ago, MERS happened a few years ago, and now we have COVID-19. And a lot of these epidemiological experts tell us, this is not the end. So we really have to modify our society, transform our society to be much more resistant and be ready and be prepped for a crisis like this. The only way we can do this is have the industry work with scientific institutions like us and come up with really transform the society with their products that are scientifically designed to come up with these mitigation measures very quickly, so as to suppress these types of pandemics early on, so that we don't fall into this mess that we are in right now.
I think it's so important. We had Dr. Fauci on. He talked about science we'd get through this, and science would lead the way, but that the private sector had a big role to play in
they had a huge role.
The innovations that you were talking about. Okay, so I want to bring all the panelists back for a second here for a couple audience questions. And Heather, the first question is for you. If I get the flu shot in August, will I be protected through the end of the season? What if I got the shot too early?
Yeah, so that's a great question, because we've had many patients come in and get their flu vaccination earlier in the season, especially students and teachers and people who are going back into school and being in those environments. And the hardest thing about influenza is we don't know when peak season is going to occur. Will it be later? Will it be earlier? Will it be right in the middle of flu season? And with COVID-19, how will that affect when our flu season peaks with both of those viruses circulating? So while we do have our immunity waning after about 6 months after receiving the flu vaccination, I think the most important thing is to still recognize that you received your flu vaccination and you're doing everything that you can to protect yourself. And just as you don't want to get a flu shot too early, you also don't want to get a flu shot necessarily too late in the season and aren't able to allow your body to produce those antibodies to adequately protect you against the flu.
So thank you for that. And I want to go back to Dr. Badalea for a second. You heard the doctor say a second ago that we have to be prepared for the next pandemic, that this is not a one and done situation. And so do you see any silver linings in this in terms of the learning and innovation, both as we saw from the Ministry of Supply today, or human beings and human behavior getting used to mask wearing? Is there any silver lining for this?
I'm really hoping so, Suzanne. I want to actually stress what Dr. Matsuoka said, because, I work on emerging infectious diseases, and what we notice is every year and a half at this point, we're discovering new human pathogens. And it's a function of the fact that, we've, even in my lifespan, we've doubled as a population on the face of the earth, and we are encroaching into areas where viruses used to live in balance with animals around them. And so we're being introduced to new viruses. And so over time, it's giving new viruses a chance to jump from wild animals, from domestic animals into us. And so these types of spillovers, these events are happening with increasing, you're not imagining it, they're happening with increasing frequency. And what we're seeing is, even in cases like, so as part of the Ebola response in West Africa in 2014, and you might have seen there was thought to be this big epidemic that happened that may not repeat. And only 2 years later in 2000, or 3 years later in 2018, we had this other epidemic in Democratic Republic of Congo. It's not just that these outbreaks are happening often, it's just that we're so connected. In 2017, 4 billion people took a flight. The way that we're dependent on each other for products, we're dependent on, and supplies, essential medications for the US come from India and China. So that global connection is there and impacts all of us. These types of changes, one lesson that we know from countries that were affected with SARS, I was a part of I was an instructor for Taiwanese CDC a few years ago, and speaking to my colleagues from the Asia Pacific Rim area, they talked about the idea that this changed the way that both their governments and their population thought about and approached pandemics and epidemics, because for the government, it sort of increased awareness of why these types of investments, whether it's healthcare infrastructure or public education or changes in our public spaces, or assisting businesses to try to create these types of environments that are safe for customers, are such an important investment. It showed the same thing for businesses, and for people, it left this memory, this historic memory about the importance of public health mitigation. So I'm actually with Jihan on the fact that I do see that when we leave this, there are probably people who will still continue to wear masks on planes or wear masks in crowded settings. I sort of see that happening over time now that we've seen the risk of these types of respiratory viruses.
I know we only have a few more minutes, and I want to get 2 quick questions in. So Dr. Matsuoka, let me come back to you for a second and ask you that question. Do you think there's a silver lining in this? Are we learning things that you're doing in your lab, things that the government is learning, that people are learning? Is there a silver lining in this?
Well, I think the silver lining is, and like Dr. Fascia said, we really just need to solve this in a scientific way, because there are so many unknowns, and we're discovering things as we go. But also, it really needs to be communicated to the public, because a global community effect. So how do we discover things? As opposed to how do we communicate this to the public? And the visualization on a supercomputer has been one of the most effective ways. Because if, for example, if the public's not well educated, and despite all the scientific discoveries, if people don't take shots, vaccine shots, or take medication, or not wear masks, or sanitize their hand, things are useless. So communication. Scientific communication, I think, is playing an ever more important role here, especially in this time of crisis.
I think you're right in that public communication piece and getting people to understand that when we get a new piece of advice, it's a good thing. It's because we learned, not a weakness in the system. So 2 quick audience questions I want to get to. Jihan, this one's for you. What should consumers look for when they're evaluating masks?
Yeah, I think it's 2 things. One, that it's an effective mask, as Dr. Matsuoka showed us, that materials matter and that you do really need a type of non-woven filter if you want kind of that highest level of protection. But one of the things that we've seen and heard from we have nearly 50,000 customers who've bought these masks, and we have all this feedback categorized. And the number one thing we hear is about improvement of comfort, and that comfort is what drives compliance and people's desire to wear them and wear them most frequently in areas where they will be close to others. So do find a mask that's comfortable, because that's what's going to drive you wearing it the most.
Thank you for that. And last, oh, go ahead.
Yeah, and that's where we also see a huge opportunity for innovation, is allowing materials to be highly breathable, because breathability and filtration, while they are intuitively inverse, there are ways to actually have higher airflow but effective filtration. And
so one last question from the audience. Does your research say, and this is for you, Dr. Matsuoka, what should we be using humidifiers in the office and at home to change how quickly droplets turn into aerosols?
Yeah, so this is a very subtle question. Obviously, ventilation. Well, firstly, I must stress that ventilation is critical. So, and there are many ways to ventilate, and the old buildings don't have them. But there are many ways to mitigate. So first, I want to really stress that wearing masks is one thing, but ventilation is almost as critical as these protective measures. As for humidification versus whether they're effective, the science is not quite there, because what we don't know is when things turn to aerosols and micro droplets, how long these viruses survive. So we've been working with the experts on this, and it becomes sort of like, if the viruses survive for a long time in these droplets, and obviously humidification works. But if they quickly become inert, then it's the other way around. So, so science here is really important. We'll be running supercomputer simulation, which is, of course, very difficult. We'll be doing experiments to basically try to discover whether humidification will be critical, or maybe it shouldn't. But that's something that's being actively studied right now.
Well, I hope you'll come back and share more results with us. I have to thank all of our panelists. You've been incredibly helpful. And thank you so much to the audience for tuning in. If you've missed any of the previous programs, you can find them at uschamberfoundation.org or on YouTube. And we just appreciate you spending your time with us, your expertise with us, panel. And to all of you, you heard it here. Go outside, wear a mask, social distance, and get your flu shot. Thanks so much. Take care of yourselves.